Good morning, Kelechi. I'm going to have you officially introduce yourself.
Hi, my name is Kelechi Ubozoh. I am a Nigerian American writer and mental health advocate, co-editor of the book We've Been Too Patient, Voices from Radical Mental Health.
You've got something big coming up on Tuesday. Talk about what that is and why that's important.
Yeah, so this coming Tuesday, there's going to be an informational session on SB 326, and that is really the Mental Health Service Act modernization. And what the governor is proposing is taking $700 million from prevention and early intervention funds that fund a lot of community-based programs, fund a lot of BIPOC and LGBTQ plus programming and peer support, and spending it, focusing it solely on the unhoused community. And what we're advocating for is that you still need a continuum of care. And yes, we do want to serve and support our unhoused communities, but they're still not. I think California has spent in the past 5 years about $20 billion on trying to fix the homeless problem, and they have not, to my understanding, really included the unhoused community in those conversations, or really focused on affordable housing as the solution. It's always, let's get the mental health service treatment, let's fix this thing, but not actually looking at, okay, what is going on in our economic system with systemic racism that makes everything so unaffordable, and why aren't we building affordable housing instead of kind of blaming this problem on mental illness. And so that's what me and a bunch of mental health advocates with lived experience of mental health issues are going to the Capitol on Tuesday to share our stories and share why we really need to keep services and prevention and early intervention services and programming, because that is going to have unintended horrible consequences for us. It's like if you got rid of all your upstream and only focused on crisis, you'll have more crises because you're not intervening early enough. So that is a bit about what we are doing on Tuesday.
One of the reasons I thought it was really important to have your voice in this story is because I think you are one of those people who are able to see the nuance and the complexity and the intersectionality and the sort of interconnectedness of the issue. So I guess why don't we start by having you talk about like what are some of the services, if you feel comfortable, or community resources, if you feel comfortable sharing, that you've been able to tap into on your own journey, caring for your own mental health.
Yeah, I think it's a little different because I was a provider of services in some ways. So but the Mental Health Service Act has profoundly impacted my life. So I moved to California in 2012 after a mental health crisis. I had a suicide attempt. I had been sexually assaulted, um, and then I went through like a recovery process. I kind of had these horrible experiences in New York where I was living. I went to Georgia because my mom was there and she wanted to make sure I got really good support. And on my road to recovery, I heard about this thing called peer support. And I'd never heard of peer support. And the peer support is where people who have experienced with trauma or mental health issues or substance use or co-occurring substance use and a mental health issue, they have been through recovery, they have learned and healed. And again, recovery is not a linear process, it's ongoing. Everyone defines it differently, but they use what they've learned to support other people. And that was so different from anything I've ever heard, because when I got into the mental health system as a young person, I was told I was broken. I was told I'd never hold down a job. I was told that I'd be on medication for the rest of my life and that it would be hard for me to have relationships. And I just was told that I would never get better. And these folks, these people, these peers said, no, recovery is possible, healing is possible. We can support you. And that was wild and amazing to me. So I experienced some peer support in Georgia, but then I really heard about California passing this law in 2004 called Prop 63, called the Mental Health Service Act. And essentially, this law taxes 1% on anyone who makes over $1 million, which in California is a lot of people. And what used to be essentially the icing on the cake of mental health services, over time, this funding has been the cake. And so they fund peer support where people with lived experience support one another. They fund community defined practices where Black, Indigenous people of color can have culturally responsive mental health programming around something that's healing centered or traditional or culturally based. And so these are things I have just so innovative and so beautiful. And taxpayers are essentially funding mental health services for our community. And so when I was so inspired by this, I moved across the country without really even having a lot of connections out here. And my mom and I drove across the country, and I ended up working at a mental health nonprofit called Peers Envisioning and Engaging in Recovery Services, where I met other people who had experiences like me, and we were creating programming that was talking about stigma, interrupting things. I was training people on how to share their recovery stories to inspire and also change policy. And it was just so impactful. So I have been impacted by the Mental Health Services Act because it let me know that, one, I wasn't the only person, and two, there were people out here doing really important work that looked like me. And I've watched it fund really innovative things for youth and young people. And I've been able to be on the research side, or the person who's implementing programs or evaluating programs. And I would say, as someone providing support, I also received support in those spaces. And so I think that has been truly something beautiful about the work of the Mental Health Service Act.
And is it within the realm of possibility that some of those funds and resources in that specific realm could be taken from to support this other ballot?
It's not even in the realm. That is exactly what's happening. So I think the reason why so many advocates are so nervous right now is because they're running, they might be running like a grassroots community-based organization where Mental Health Service Act is funding a significant amount of their services and supports. And a lot of people say, oh, you know what? We have Medi-Cal billing and we should all move to Medi-Cal billing. And so then you will get reimbursed by the state. But if you're not an organization who has like a clinical supervisor or provider who knows how to bill, I certainly don't know how to bill Medi-Cal, and a lot of peer-run organizations who do not have a formal relationship with a county or do not have a clinician in, on staff, will not be doing that and won't have access to that. So Mental Health Service Acts makes it accessible for people who might be grassroots, who might be doing something innovative, who have been doing things for years, at this point it's been like over a decade of services. We're almost coming up on 20 years, and next year will be 20 years since this has passed. So yeah, I think that's just something to note, is that like what we're really worried about is that the governor is proposing, or at least has been proposing, to take $700 million from prevention and early intervention, from this pot of money, to focus on one population, whereas the Mental Health Service Act has been focused on multiple populations. And so I think we'll have unintended consequences, even though I think the intent is good. I'm deeply concerned about the impact.
Yeah. And I'm going to go back to something you said near the beginning of our interview. You just said if we only focus on the crisis part and not early interventions, we're just going to have more crisis situations, which seems spot on. I'm thinking about some of the unhoused folks I've been interviewing. Like I spoke with a woman not too long ago who's 25, who's been on the streets since she was 12.
Mm.
If I did, and she's from another state, possibly a human trafficking victim at some point in her journey. So there's trauma at the root of that, right? And then I spoke with another unhoused woman, or formerly unhoused woman, who had some trauma and didn't know how to access support early on. And she's very sure, I'll focus on this latter person. She's very sure that had she had an early intervention, had she had somebody who could have talked with her and helped her face what she had endured, that she might have had a different outcome, that she might not have ended up maybe on the streets. And so maybe if you'd like to help us kind of dive in a little bit and talk about, from your perspective, how do early interventions actually, how might they help so that we avoid a crisis situation?
Yeah, I think what folks don't sometimes understand is that I think sometimes when they hear a diagnosis or they hear the language of mental illness, they think that's like a sentence, like that is someone's forever state and experience. But for folks who have experienced trauma, and I'm someone who's experienced trauma, and I did not get good help early on for my support, like for my recovery. What I was told was that I was broken. It was up to me. It was very individualized, and all these really things that made me scared to ever talk to anyone again. It was like, oh, let me hide this and never talk to anyone. But when I did get really good support in my 20s, I was more like, wow, what I needed and what a lot of people need when they're going through a difficult time. Like, we act as if this pandemic is over and everything's fine, but so many people lost, people are moving through grief. Suicides are up for our young people and for our Black and brown kids. And what we're not really understanding and talking about is that, like, when people have caring adults, when people have early interventions, like learning how to cope with trauma, they are in a better place to deal with other things as they get older. So many people, and again, you don't have to be a young person to get an early intervention, right? You could be on your recovery journey, or like maybe you're in your 30s, and or like even getting close to menopause and other things are happening with your mental health around menopause, for example. If you're able to get peer support, early treatment, resources to know what's going on and to be the director of your own care, it is so much more impactful for then when you wait, or you're trying to go to every door and every door is closed because there's a long line, right? There's like a waiting list for 6 months to get an appointment. That 6 months really impacts people. So having early intervention services, having grassroots free services. I mean, these things are not, these things, a lot of these prevention and early intervention programs are free, and you could drop into a support group and get support and have other people around you to talk about what's going on. And peer support is also an evidence-based practice that we don't always uplift, is that when you see someone else who's been through what you've been through and they can talk about it openly, and talk about your recovery journey and what they've done, and also get to understand what are your options, you have such better outcomes than when you're, oh my goodness, we're waiting until a crisis, we're waiting to respond in a crisis. And our system is very crisis focused. Like, people have been trying to get help for months and months and months, and the only door they can go through at some point, because the crisis gets so big, is that they end up having to call 911. And 911 should not be an emergency respondent for like a mental health need that we could have reached months ago through our services, through our programs, through our outreach, through our interventions. So, I mean, we just know that it works, but people see folks unhoused, and they see, oh, this is a visible problem. They see folks who may be acting in ways that are different from them and say, oh my goodness, let's attach this to mental illness. And that's what they see. they don't see all of the people who've been intervened on. Like, you don't get to hear those stories. You don't get to hear people's success stories of what has been helpful to them. And I think that is kind of what we're working, I don't want to say working against, because again, we do need services and support for the unhoused community, but more than ever, we need housing for them. And the housing first model, to house someone first, is really what we should be moving to, not let's put them into treatment and give them a bunch of rules. You can't do this, you can't do that. We need harm reduction and we need housing first for those folks. So I hope I answered your question. I feel like I went around the world in 20
No,
days.
it's okay. That's how I communicate to you. And lastly, like, so you mentioned, housing first is a way to focus. That's one solution. Otherwise, like I was going to say, if somebody said Kelechi gets to come up with a solution, what would the holistic solution look like that keeps funding those peer-based community grassroots programs and supporting this other vulnerable population? Housing first, yes. And anything else you want to add on to that?
In an ideal world, like a really ideal world, we have voluntary community-based programming that is well funded. Our mental health services have never been fully funded to take care of everyone. And so sometimes we're kind of like trying to split a piece of pie, but we need a whole continuum. We need things for children, we need things for older adults, we need the entire spectrum of mental health services for every single population. And sometimes when we get into these conversations, it becomes a battle about a piece of the pie, instead of like zooming out and saying, you know what, why are there really ridiculously long waits for someone to get into psychiatric treatment if that's what they want, to have access to peers if that's what they want. Like, we have some clogs in our system that we need to fix, and that definitely needs to be modernized. It is not perfect, but in an ideal world, we need low income housing. People have been deeply impacted by the pandemic. People have lost their jobs. We need to really take care of folks by providing them something that is stable and that's not going to go away. So I think that's one step. And the other step is that the racial disparities that happened and that have been going on for forever, but that were really exasperated by the pandemic, have not been addressed. Our Black, Indigenous people of color need mental health support and programming more than ever. And what this is proposing to do is taking away and giving them less. Our LGBTQ plus communities need more support than ever, especially with these, it is rough out there. It is transphobic, it's homophobic out there. So knowing the political nature of what's going on, people trying to ban books, ban humans, this is the time where we need those programs and support more than ever, not to take them away. We need to focus on all of our communities, not just one. So if you take from one, you really will deeply impact all of the others. And I know that is not the intention, but that's definitely the impact.
Thank you. I appreciate you sharing your perspective and your experience. Is there anything else you want to add before we conclude today?
I think the only other thing I would add is that recovery is really possible. People can heal and get better. And sometimes people see us at our worst. As someone who has lived experience of mental health issues, of trauma, when people see us at our worst, they think that we cannot make decisions for ourselves, or we can't advocate for ourselves, or that we won't ever get better. But really, we need to be able to make our own decisions and be part of the conversation. So when policies happen without us, without the unhoused community, without the Black, Indigenous people of color folks, without the LGBTQ plus communities, we run into these types of huge issues. When people make decisions without us, and a huge part of our peer and disability rights community statement is nothing about us without us. And this is what happens when it's about us without us, is that you have all of these, oh no, they didn't think about this, they didn't think about this part. So my last statement would really be is to uplift nothing about us without us. we need to be at the table because we understand your programs and what the policy means more than anyone else as the people who will be firstly impacted by these changes. So we need to be included, and that's what will help heal and come up with solutions that will actually be good for everyone.
Thank you so much. And before you go, mention the name of your book one more time, or if you have one handy, show us one. But if not, just tell us the title.
I'm like, there's one around the corner. Can I run and grab it? Is that weird?
Go get it.
Okay, I'll be right back. So this is my book, and it's our book with my co-editor, LD Green. It's called We've Been Too Patient, Voices from Radical Mental Health. And it is stories and research challenging the biomedical model. That's the model that says you're broken, you have a chemical imbalance. It doesn't consider race, it doesn't consider culture, recovery, healing, or peer support. So we have an anthology where we're talking about, from people who are the patients in the system, about our stories and our experiences. And I believe we're going to have an audiobook of this coming in the future. So more to come on that.
Awesome. Thank you so much for taking the time to talk with me today.
Absolutely. I really appreciate you, Sharon.
Appreciate you too. And you're going to be in Sacramento on Tuesday at what time?
Yes, join us Sacramento Tuesday. We are going to start at 8 a.m. You can meet us. If you are like, I'm so sorry, I have to literally pull up a flyer because I'm not telling people the wrong thing. I will not. Okay, so on Tuesday, August 22nd, there's an informational hearing for SB 326. It's at 9 a.m. Please arrive early, space is limited. We are also going to be and it's going to be at the Capitol Annex Swing Space. So that's 1021 O Street, 1100 Sacramento, 1021 O Street, and that's 1100 Sacramento, California. And we are going to be at the corner of N and 10th Street at 8 a.m. with t-shirts that say no on SB 326 and talking points. So if you want to join us, we will be there with our bright green shirts, which stand for mental health, which is lime colored. And just, yeah, please join us. And your voices really matter. We're already starting to see some changes that the governor's made on behalf of children because of the advocates. So we just need to get him to do it for our BIPOC and LGBTQ plus communities. So your voice does matter. I hope you can join us.
All right. Thank you so much.
Thank you.